Bismillahirrahmanirrahim. Assalamu alaikum everyone. This is Dr. Mubasshra and today we are going to discuss MRCP PACES communication skills and a very important topic that is dealing with angry patient or relative. In this video, I will break down one of the most challenging scenarios that the doctors face in MRCP PACES as well as in real clinical practice, and I will tell you how to handle a difficult patient or relative with confidence and empathy. At the end of this video, you will learn how to stay calm, communicate effectively, and rebuild trust and learn the skills essential for PACES and everyday ward work. This is one of the most feared but very high-yield clinical communication scenario, but if you follow a structured approach, you can handle it like a pro. Stay with me till the end and you will learn a structured approach that works every time. So let's start with a scenario. You are the medical registrar on duty in a busy medical ward. A patient's daughter is very upset because her father's anticoagulation, that is warfarin, was stopped before colonoscopy procedure and he has now developed stroke. She believes that this has happened due to medical error. Your task is explain the situation to the daughter and manage the concerns. After reading the scenario carefully, prepare your page, write the name of the patient, his age and with whom you have to talk as a surrogate and what is their relation with the patient. Write any important point or agenda, any legal and ethical issues which you have to cover inside. Now let's discuss that how to move forward in this scenario. So first of all, before entering the room, take a deep breath and compose yourself and remind yourself that don't panic, stay calm, be empathetic and professional. And the second thing is introduction, greeting and setting the agenda. Enter with a calm and professional posture. Greet her respectfully and introduce yourself clearly. Then comes acknowledge. Start with empathy and say, I can see how worried and upset you are. This must be very distressing for you. Empathy always comes before explanation, and these sentences will help to diffuse the anger and show genuine concern from the doctor's side. After that, let her vent out without interrupting. Allow her to express her anger fully and use active listening by head nodding and saying positive words. For example, I can see, please go on. Don't become defensive or jump to medical explanations too early and never confront the patient or surrogate. This is actually crucial for PACES and it demonstrates understanding and organization. Give a clear and calm explanation. Avoid medical jargons and explain that why warfarin is stopped before the procedure. Clarify that the team followed standard guidelines and state that despite careful planning, complications can still occur. Keep your tone soft, neutral, compassionate and non-defensive. Like for example, you can say warfarin increases the risk of bleeding, especially during procedures, for example, colonoscopy, that is the camera test of big bowel as your father has undergone. To keep your father safe, it was stopped temporarily, and even with careful planning, there is still a small risk of clotting or stroke. Then comes a very important point, that is apologize. This apology is not for event but for the distress. You can use sentences like, I'm really sorry for what your father is going through. I'm sorry this has happened to your father. This is actually acceptable and encouraged in PACES, and apologizing does not always mean admitting negligence. Then comes rebuild trust. Reassure her about ongoing care and tell her that your father is receiving the best possible treatment right now and explain the current plan about stroke, neurology involvement, rehabilitation and monitoring without using medical jargons. Say that the brain specialist doctors are involved and we are monitoring your father closely. We are taking care of your father. He is our topmost priority. We will not leave him alone and we will provide him with the best possible treatment. This step shifts the conversation from anger to safety. Then comes concern management. Keep on asking the concerns and answering them in an appropriate manner. Provide updates at regular intervals. This empowers the relative and shows professionalism. There can be a concern over here, like is it a medical error, or for example, she will ask the steps to launch the medical error. So, the problem here is that you have to deal with empathy as well as in a professional manner. Like, for example, for this concern, you can answer like, I appreciate your concern. At this moment, our topmost priority is your father. And let me tell you that this is not a medical error, but it is a complication or side effect of the treatment. But if you still want to launch a complaint, I will tell you the steps after this communication. Then comes close the conversation gracefully. Summarize the key points and reassure your availability. That is, I am here for you. If you have any concerns or want an update, please do let me know. Then comes conclusion, and here I want to tell you about the key principles in PACES communication. These are stay calm, be empathetic, and empathize deeply. Explain clearly, rebuild trust, active listening, structured approach, non defensive attitude, patient centered care, and professionalism. If you find this video helpful, don't forget to like, share, and subscribe for more real life clinical communication demos. Thank you so much for watching. Stay blessed. Allah Hafiz.